Hi, everyone. My name is Brent Pavia. I'm the president of the Bloomington Chamber. Welcome to Bloomington Chamber Town Talk. And this particular edition around public health update in Bloomington. Want to start out first by acknowledging our sponsors for this event. We really couldn't do this without the support of the community, and especially as we've changed to go virtually, it's made a big difference as well. So thank you in particular. You see the logos at the bottom of the screen. I want to thank Mall of America as a presenting sponsor, along with my credit union, CenterPoint Energy, Excel Energy, and Wells Fargo. As I mentioned earlier, we are able to do this in large in large support from these sponsors, and I encourage you to, as we go through this, ask some questions. Otherwise, I'll just dominate the conversation, and nobody really wants that. So it's been about a year of this pandemic that we've been in. And in fact, it was a year ago, March 12th, that we had Bloomington Chamber Town Talk at Bloomington Civic Plaza in person. It was all about, if some of you were there, construction around the airport. And you could tell things were changing. It felt like the sword of Damocles was above our heads as we knew that the pandemic was on us, and we would have to make some serious changes. In fact, I remember at that event, the Bloomington mayor and city manager coming in, and I felt like I was being called to the principal's office. I knew that there were some changes. In fact, the Bloomington State of the City, which was going to be the following week, was going to be canceled, and our worlds would change dramatically. So what also happened at that time was Bloomington engaged in a regular community partners meeting that I've been a part of, along with some other leaders in the community. And I had the privilege of meeting and hearing from on a regular basis Dr. Nick Kelly. And I couldn't be more thrilled that he's going to be able to tell us a little bit about the current state of affairs, but just a little bit on Nick before I let him take over in terms of a little presentation and then getting into some Q&A. Nick Kelly is the acting public health administrator for the City of Bloomington's Public Health Division. He's also in that role the incident commander for COVID-19 operations. Prior to COVID-19, he directed the division work on public health preparedness, planning, and data analysis, national accreditation, strategic planning, performance management, and other administrative duties. He's really passionate about evidence-based public health and health equity. He lectures on public health impacts for critical infrastructure in the Technology Leadership Institute at the University of Minnesota. In 2012, he was a fellow in Emerging Leaders in Biosecurity from the Center for Health Security at Johns Hopkins. He's earned both his MA and PhD in environmental health from our flagship university down the road, the University of Minnesota. Dr. Kelly, thank you for joining us today. Take it away.
Thank you, Brett. It's excited to be here and talk a little bit about public health and some of the journey we've been on, and a little bit more about what Bloomington Public Health has to offer our community. So we'll start off with what is public health. Many of you have gotten very familiar with public health as the entity helping provide guidance or direction in what you can and can't do during a pandemic. But the reality is public health is a very broad area, and we like to talk about it as what we can, as a society, collectively do to ensure the conditions in which people can be healthy. And that's really broad because public health is a very broad field. So anything that impacts the health and well-being of the community, in this case, think about your workforce, the people you're recruiting in the workforce, and where they're living impacts the public health. And that's something that we work on routinely to address. In Minnesota, we can get a little bit more granular with what is public health. Minnesota Statute 145A defines the duties of community health boards, which is what we call local public health, our community health boards. So here in Bloomington, our Bloomington City Council is the community health board. They authorize us to do this work. So there's 6 areas of responsibility that we're responsible for in state statute to ensure public health in Minnesota in partnership with the state. It's assuring local public health infrastructure, promoting healthy behaviors and healthy community, preventing the spread of infectious disease. We've spent a whole lot of time this past year focusing on that. Protecting against environmental health hazards, that's what our environmental health division excels at here at the City of Bloomington. Then preparing for and responding to disasters and assisting communities in recovery. Again, something we've been spending a lot of time on with COVID-19. And then assuring the quality and accessibility of health. Those are the areas that we really focus on. And we do that in this partnership between federal, state, and local health. So at the federal level, you have high-level leadership for what public health is. And we see that coming from Health and Human Services through the CDC, the FDA, and other governmental public health entities that way that kind of set the standards and expectations for public health at the federal level. That's pushed down to all of our state and territorial health offices. And so the state of Minnesota processes the guidelines and the recommendations from the federal level, often from the CDC or the FDA, and distributes that and adapts it to meet the needs of Minnesota. They push that out, and then we work in partnership here in Minnesota with our state health department and our local health departments to really execute that work. And so, for example, the vaccinations it's a federal guidelines of how we're vaccinating for COVID-19. That's then implemented at the state level with additional guidelines, and then the state or local public health end up being the boots on the ground doing that vaccine work. So it's this partnership that goes across all these levels, and it works really, really well. We're a little unique here in Bloomington as part of Hennepin County. As I mentioned, there's community health boards. Most community health boards in Minnesota are at the county level. There are 4 community health boards that are at the city level, and they're all in Hennepin County: Minneapolis, Edina, and Richfield and Bloomington. So we have the privilege of serving Edina and Richfield in addition to Bloomington, and work really closely with our partners at Hennepin County and the city of Minneapolis to provide that seamless public health service across the county. That affords us the ability to work with a larger population and maximize resources. And we spend a lot of that time partnering with the county. So an example of how we do that is some of our community health assessments or community health improvement plans that we do. Every 5 years, we're assessing the health status of the community and looking at what needs to change to help improve community health and well-being. So the priorities we've been working on with Minneapolis and Hennepin County are housing stability and community mental well-being. And that's based on a data assessment and process that we do on a routine basis to understand the health needs and changes in our community and work together with our county and other city partners to address those issues. Part of that's really driven by what creates health. Many people look at health as, oh, you know, I do this, I go to my doctor and I'm healthy. The reality is we know about 70% of what creates your health is really your social economic factors, health behaviors, and the physical environment you live in. And so being at a city level, or we have a lot of ability to influence those. Whether it's our park systems, it's how we access transportation, it's where we go grocery shopping. Those things have a huge impact on the health status of the community that we serve. And that's something that we get to spend a lot of time thinking about as you navigate population health. And the reality of some of those challenges is many people live in areas where they don't have access to some of those things. And public health is transitioning away from you need to exercise and eat these kind of foods, to recognizing that's sometimes really hard for people to do if they don't have access to a place to exercise, like a safe park or sidewalks, or don't have access to healthy foods because they live in an area where there's not a grocery store nearby, or their only access to food may be convenience stores or fast food restaurants. So thinking about those things holistically allows us to kind of tailor some of our public health strategies at a population level to really meet some of those needs. So we've shifted a bit in public health. Like everybody else, we've had to adapt in some of these environments, and we went through an organizational change that started at the beginning of 2021. We modified some of our structure and created a new unit within our public health agency called Population Health and Planning, really to focus on that reality of the future of public health is a whole lot more of that big picture policy system environmental change. And so we do a lot of work now building that capacity, and recently hired a staff member to replace some vacancies and challenges we had on that end to really focus on that health and all policies, really making sure the work we do and the work across the city of Bloomington and supporting Edina Richfield is focused on making sure our actions are actually supporting healthy behaviors for the future. We still do our core services, our clinical services and disease prevention and control unit. That's where our women, infant, and children program happens, where we take care of new moms and young kids with nutritional supplements and breastfeeding support. Also, that's where we do a lot of our disease investigation. We have our family health side, which does a tremendous amount of work with maternal and child health, really helping the young kids in Bloomington, Edina and Richfield, and their parents start off on the right foot so that those kids have access to the same potential for health the rest of their life. And then we do work with vulnerable adults and older adults that are running into some of the health challenges at the other end of the spectrum, and really helping them access services and resources so that they can continue to live vibrant, active lives in our community. And then we have communications, finance, and administrative services, the kind of the backbones of making our agency work. They support everything else we do. So that kind of gives you a kind of a high level overview of some of the work we do on the public health end. And then thinking about the interaction and connection with the business side, the timing on this was great. The DeMomont Foundation and Johns Hopkins have been doing a lot of work understanding the business public health interaction for a while. They did some really good work in 2019 highlighting the business case for partnering with public health. And some of the feedback they've gotten through this pandemic is highlighting 7 ways businesses can really partner and build those relationships with public health. And in the first one, it was probably no surprise to anybody, but really helping us deal with COVID by listening to public health experts and the credible public health experts in the partnerships. And I would have to say, I can't think of a better place to be right now than in Bloomington with the partners we have here. Some of them are on the call today. The business community and the partners that we've been able to work with were often not new. We've had long-standing relationships with many of our business members in Bloomington, and it's been a phenomenal partnership to just see that relationship grow and continue to work to serve our community, because both of us have the same interest. We want our communities to be healthy and our economy to be thriving. And the best way to do that is to keep people healthy and safe. And so they've done phenomenal amounts of work following public health guidance, working with anybody from the city working on that aspect. And it's been amazing to see. The second is improving the health and well-being of employees. So we've seen many businesses starting to approach that with a lot more vigor, of whether it's focusing on sick leave or other policies. We've seen the burgeons of the work from home and the reductions in stress with the commute, but then the other challenges. And so that's the constant balance of that aspect. Promoting healthy communities. Many members in our business community are active participants in that process of helping us understand how to make the best choices to improve the community well-being. And then thinking about that force multiplier, we've seen that a lot in this pandemic, where some of our business partners have come alongside us and helped us with the communication or information sharing to really make sure the messages get out and that we're all focusing on that public health work. And then I've been part of many partnerships here, of that public-private partnership working to improve public health and community well-being. And we also get some really good questions from our business community advocating for the development of better data and more accountability. And that's great to see. And I think we're going to see a lot more of that as data systems and people become more familiar with those processes. And then thinking about how we rebuild and expand the workforce. Public health has shrunk quite a bit over the last decade. And now we're seeing some of the challenges of trying to rapidly scale that workforce and pivot in the middle of a pandemic. And so we see some federal investments coming of the likelihood of 100,000 new public health workers in the near future, and looking forward to those partnerships with our business community and community of how that is implemented and rolled out across our community and the state of Minnesota. Getting a little bit more granular on some of those services and things that we can do to really help businesses. The first one there is breastfeeding information and support. Our team has put together a phenomenal amount of resources to assist businesses in being breastfeeding friendly. It's a state law requiring access to space for moms to be able to pump and take care of their young children at home if they're choosing to breastfeed. And we have resources and policies that are samples out there to really help. If your business doesn't have some of those tools already in place, there's toolkits that we have to help you do that. In addition to some of the screening, immunizations, and then prenatal, postpartum guidance and some of our senior health and services. And we also know that many individuals are also using our WIC services that way too. And that's it's a great way to help make sure some of your employees that need that extra support are getting it so that they can have vibrant and healthy children and keep moving forward. So kind of transitioning from our public health services to COVID. I still remember in January of last year reading this update from the World Health Organization on January 5th about this pneumonia of unknown origin. And we often see this in public health. And I kind of just read it and I was like, I wonder what's going on. Not really sure what it was. Not really an inkling that this was going to be a pandemic. And I remember the more we started learning, I was in my boss's office at that time towards the end of January, early February. And I was like, I think this might be a big deal. We're going to have to potentially change some stuff. So we actually started pulling some of my other duties away and started really focusing more on our emergency preparedness and some of our tactics and response strategies. And before we knew it, we were in the middle of a full-blown pandemic. And the last year has just been an incredible journey. Most people that know me know I'm a nerd and love infectious diseases, but been really challenged by this pandemic. And so these are, it's a transmission electron microscopy of what the SARS-CoV-2 virus looks like, and then a computer animation of what that looks like. From the CDC, I think it's always helpful to understand what our common enemy looks like. COVID, the disease caused by SARS-CoV-2, is the thing we've all been uniformly focused on the last year. This is what it looks like. And this gives you a little bit of insight into what it's done in our community. So this is our COVID dashboard, where we update it every day of the week, understanding what's going on in the community. And you can see we've had 147 of our neighbors here in Bloomington succumb to this disease. You know, we're over 6,700 individuals in Minnesota and over 520,000 Americans. That's not even getting into the global impact. This pandemic has been just devastating in many ways, from a human cost, economic, mental well-being. It is a real challenge. So if you haven't explored this dashboard, I would encourage you to do it. We have a tiny URL there. It's blm.mn/c-. It's a phenomenal resource. There's tabs at the bottom of the dashboard that get into a little bit more detail about what's going on by race, by age, by exposure. It's really helpful to understand what's happening. And then I'm going to go through a little bit more of some of our journey. So this is the 7-day rolling average of new cases in Bloomington since the start of the pandemic. We didn't have our first case, thankfully, until towards the end of mid to late March. And you can see that the blue line in this graph is our 7-day rolling average of cases per 100,000 population, which is a way that's standardized a bit more. It's comparable to data that's shared at the federal level and international level. And you can see we've had lots of ebbs and flows. We've gone up, we've gone down, and been relatively in a constant state through the summer. And then we hit October and things started taking off like a rocket. And we had that really challenging fall wave where things really took off. We dropped down a little bit and then we peaked again right after Thanksgiving. We saw that Thanksgiving bump with a second little peak. And then we dropped very quickly. And then we're back down into kind of that level we were towards the end of September, early October, which is still a place we don't really want to be. We want to see cases down at a really, really low level because COVID, it's such a dynamic situation. It can go the other direction very quickly. And so the lower you are from a case volume level, the more stability you can have and the more runway or lead time you're going to have before things go the wrong direction, and the ability to mitigate that with some public health action. This is one of the ways we understand what's going on in the community. We look at cases by age group. And so you can see there's a lot of uniformity across different age groups with the clustering of cases. We all kind of ebbed and flowed at different times. We all had that big peak in that October, November timeframe. And this helps us understand what's really going on. And right now we can see one of the age groups that we're still seeing an increase while most everybody else is decreasing is that 40 to 49 age group. We're carefully monitoring that 19 and under with our school district partners as Bloomington's bringing students back today, which it's an exciting thing to see students back in the classroom, but it also gives us a little bit of something to follow and track. One of the things that's most exciting for me about this data is when you look at the 70 and over, and you can see those cases have essentially bottomed out. They're down at 0. That's a phenomenal impact we're seeing from the vaccine, and we'll see a little bit more of that in another slide. This is hospitalizations by age group, and we can see the majority of hospitalizations in Bloomington, very consistent with what we've seen at the state and national level, have been in the 50 and above age groups. That doesn't mean we haven't seen hospitalizations in other age groups. We've just seen a much smaller amount. And that's really been a hallmark of some of this pandemic response is the older you are, the more you have chronic health conditions or certain other occupational risk factors, you are more likely to be hospitalized. We put that in context with our population stratified COVID case rates by race. And so this is cumulative cases by race per capita. So it's standardized, so it's comparable. And you can see our Hispanic Latino community has been heavily impacted, just like our Black non-Hispanic and our BIPOC, our Black, Indigenous, and people of color. 2 to 3 times more cases per capita than we see in the white non-Hispanic community. And when you adjust this for age too, you still see that same spread. We have seen our essential workers, many of the folks you employ and have been doing everything you can to keep safe, be really challenged by not having the ability to work from home and being on the front lines. And we also see a disproportionate impact in multi-unit housing and some of those other challenges, which puts many members of our BIPOC community at a higher risk of getting COVID. So while we saw hospitalizations that way, when we adjust it and look at it by race and ethnicity, we see the same impact. So it's highlights there's a lot of disparities and disproportional impacts we've seen in this pandemic. And then this looks at hospitalizations by month. Corresponding with our surge in cases we saw in October, November, we saw hospitalizations peak in November and then slowly go back down. Hospitalizations is a little bit of a delayed process from cases. It may take about a week to 2 weeks to see somebody get hospitalized from COVID. And this is a really busy graphic, but it is one that we use often to understand what is going on. And so this shows the proportion of cases by exposure type. And so you can see early on, we saw most of the colors are in that yellow, which is the congregate living, our long-term care. The governor enacted a really solid plan to control those outbreaks. And we saw that proportion dropped substantially. It was always present, but the exciting thing on our end, and many of us in public health, is when you look at that February and March timeframe over on the right side, you see the orange bar is getting really, really small. That's the impact of COVID vaccinations and our long-term care in our communities for our older adults. We also see that drop in the healthcare side. The exciting thing for us is we're going to start seeing that drop in the community as we start seeing more and more occupational groups vaccinated. This one by living setting makes it even more explicit. You can see the long-term care in orange again essentially disappear in the last, basically starting in February, once we started to see our long-term care residents get that second dose. And that really started dropping in January when the vaccinations really started ramping up. That's the exciting thing for us to see as vaccine becomes more and more plentiful and roll out, is we're really starting to see that impact. So throughout this pandemic, there's been a whole lot of things we've learned and had to adapt and process. And so how does COVID spread? COVID's a respiratory infection, so it's respiratory droplets. And for a long time, there's been, you communicate science and public health with some dogma, or it's droplet or airborne, and they're very defined things. Well, as most things in life, there's very few things that are that discrete of purely black or purely white. The reality is it's a gradient. And so the appreciation of the gradient of how respiratory droplets occur was not fully appreciated in most of our public health guidance and how we communicated it. And that's caused a whole lot of challenges and issues in understanding what's going on. So any of you have seen, musical theater or seen, somebody get really excited in a presentation, and you can see the little spit coming out of their mouth while they're singing that song or talking about some of their favorite things. That's droplets. So those are what we call the large droplets. They fall out of the air fairly quickly in a short range. We also see when that happens, there's things you can't see, sort of like when you walk into a room and you see the dust being illuminated by the sunlight. Those are the small particles. That's more what we get into the aerosol or airborne. The reality is with COVID, both of those things are happening. And so that close proximity, you have the ability to get that droplet, but you also have the ability to get some of those aerosols. And so that really gets into that time and the duration and ventilation. The contact is another possibility for a transmission, but we really see almost no evidence for COVID being transmitted by touch. It's a respiratory pathogen, so the ability is always there, but most of the time it's confounded, or we can't clearly look at it, because if you're touching things, you're more likely also to be exposed to the airborne or droplet transmission routes, which are the primary points of concern, which is why we focus on that short-term contact and close proximity, and why we've done a lot of work modeling the language we've seen come out of Japan. Japan was very quick to identify that from their contact investigation work, and they called it the 3 Cs. We adopted that and pushed that out in our communication to really avoid those crowded places, close contact, in confined spaces. That's where we see airborne or spread much more opportunistic. The reality is we're not seeing a whole lot of that in more of these transitory quick movements in and out following that public health guidance. But if you're sitting somewhere for an hour in close proximity and there's poor ventilation, it's a much higher risk activity. And then we think about vaccines. If you've not done it already, register for the Minnesota Vaccine Connector. That is the best way to get connected with a vaccine in Minnesota right now. Connect with your health system, make sure that you're updated in the system on that process. And then if you're having challenges using that tool, call the phone number 833-431-2053 and get in the system. That system is incredibly effective. The state uses it for their mass vaccination sites. We use it. It is one of the easiest ways to get multiple points of contact for a vaccine. And then on the vaccine front, we have 3 incredibly safe vaccines that are very effective. And I'm often asked, what vaccine should I get? And my answer is, get the first one that's offered to you. The reality for me, as somebody that spent a lot of my life studying pandemics, I was pretty certain that we were going to be 18 months into this pandemic before we even saw a vaccine hit clinical trial and then slowly start building up the capacity. The reality is we're looking at a situation here in the US where within 18 months of this pandemic being started, almost every adult will be vaccinated. If you would have told me that a year ago, I would have laughed at you, because I thought that would have been just an impossible thing to do. That is a byproduct of investment in science and public health infrastructure. These vaccines have been in development for years. I remember talking about mRNA vaccines in my PhD, looking at flu vaccines. It was one of those emerging technologies that we thought had a lot of promise, and the stars aligned that way, and we were able to make that happen due to that investment. It's just a phenomenal success story from science. We are ecstatic about that opportunity, and vaccines are really that exit from this pandemic. And so as soon as you get that opportunity to get vaccinated, please get vaccinated, and encourage anybody that you know, your staff, your coworkers, your community members, to get vaccinated. That is one of the ways we are going to get through and see the end of this pandemic. And then we have some challenges for the future. You've all heard conversations about variants of concern. The B117 is the one that's been in the news most recently here in Minnesota, with the outbreak occurring in Carver County. I don't think Carver is in a unique situation. I think we are probably going to see more and more of that as we get better and better at detecting it. The variants of concern are there because they spread faster, and they can cause, especially with the B117, we do see an increased impact in how people are getting sick, and an increase in a small increase in the proportion of people that may have a fatal outcome. It is a challenge because how quickly they can spread. And so we're at the end of a year of a pandemic, and everybody's tired and frustrated with process. It has been a really, really hard year. And the idea of digging in and being really focused on mitigations at this point, when spring is happening and people want to do this and everything wants to change and vaccines are here, there's so much optimism. You got to balance that a little bit with, we can't do too much one way, because we don't know what the variants are going to do. They may end up being a huge challenge and cause a big increase in cases. They may not. It is really up to us to decide that, based on how we do our mitigation strategies, how we are following the social distancing, masking, and minimizing that kind of contact while getting vaccinated. It's a race right now. The other challenge we're running into is vaccine coverage. So just like many of you have dealt with the reality of individuals not wanting to wear a mask or struggling with this or that implementation, we don't know exactly where we're going to end up with vaccine coverage. We know we need a high percentage of the population to be vaccinated to really provide that population level immunity that helps us get through the pandemic. We know all adults in the United States will be able to be vaccinated probably by May, if not June at the latest. But I think it's increasingly becoming earlier and earlier with our capacity. That doesn't mean everybody's going to get it. And we don't really know how many people won't get it. And then we also know right now we're not vaccinating people under the age of 16. So there's still going to be a sizable chunk of the community that's not vaccinated that we need to have as high of a vaccine coverage as possible. And then when does it end? I wish there would be like a day we can put on the calendar, be like, okay, pandemic's over, everything goes back to normal. The reality is this will likely end up being an endemic infection. It'll be very similar probably to what we see at some point in time down the road, like a childhood disease, where, you know, every winter people get an influenza-like illness, and we've become accustomed to it and adapted. When and how that happens is a point that's yet to be determined. There will likely not be a day where we, like here in Bloomington, everything's over. It'll be the slow, gradual transition, and we don't know exactly when that's going to happen. We will see more and more of those changes occur the more and more people get vaccinated, and restrictions adjust and adapt as we protect those most vulnerable. And then one of the things that's become really clear to me, and it's one of the reasons where I think we're in a very fortunate situation here in Bloomington, is approaching this whole process with humility. There are things that the science changed, and we have to keep adjusting and adapting. And you can't do that if you don't approach this with some humility. And then partners. The partners that we've worked with, the school district, the Mall of America, other businesses in the community, have just been critical for the success. And that partnership we have, you can't do this alone. And then the fact that we're all going to that common purpose of improving our community and the health and well-being and protecting our community has really made it a much easier process to go through. This has been an incredible challenge, but it is much easier to go through that challenge when you have partners that are working together to get through it together. And so with that, I think there's some questions popping up, and happy to do some questions about COVID or public health in general.
Yeah, thanks, Nick. That's a great overview, and really appreciate everything you were able to bring there. I think you touched on this a little bit with the dashboards, but one of the questions was about communication efforts to citizens. I know that each of the cities has a dashboard. I'm sure there's a kind of regular communications through city publications, that sort of thing, but are there other areas that you've kind of exploited because of the pandemic around communications?
It's a good question. We have been working for a long time now. The 3 cities PIOs have been working together on how do we get messaging out to our community. So we've been using a variety of means, from the website, social media, pushing out information to partners. We've been going into the community and having conversations with different community group leaders. We've been very intentional on reaching our BIPOC community across those 3 communities. And so we're having regular conversations with leaders from those communities, especially early on. We were talking about mitigations and how do you deal with COVID? How do you prevent yourself from getting COVID? How do you get access to tests, support services? Now those conversations have shifted quite a bit to vaccination. How do you get a vaccine? What's it look like to come to one of our clinics? What's it look like to go to a partner's clinic in the health system or the state system? How do we get that message out and support that? And so that's been something that we've been really pushing, but it's also one of the challenges you have. We're rapidly approaching that time where a lot of the easy population groups in easy communications we've vaccinated. And so as we continue to push through and focus on how do we equitably provide vaccine, that's a lot more work. It's realizing and building on those partnerships to make sure that the community knows where there's things to access. And so we continue to use all of the city's communication channels and push information out to our partners, but it's one of those things where I think we're always going to find ways we could do it better. I can't think of a single time in any of the exercises or preparedness work we've done in the past where we planned for these things where communication and coordination of information wasn't one of the things that, we didn't quite get right. And there's always going to be that room for improvement.
Sure. Well, and to follow up a little bit more on the equity issue, we all have heard quite a bit about the social determinants of health. You talked a little bit about that in your presentation. I know within the last couple of months, the city of Bloomington declared racism as a public health crisis. I guess two questions on that. How does that impact the work that you do? And some of the data that's in the dashboard, does that bear out that certain populations are more at risk or have been more impacted in particular by COVID? And are you also concerned about the kind of vaccine hesitancy within those populations?
Yeah, so it's a yes. We have clearly seen the disproportionate impact, and it goes on both ends. And so while we see the majority of our cases be hospitalized or deaths have been in our older population, which tends to be more white, non-Hispanic, when you stratify that out by adjust for age and race and ethnicity, you still see that disproportionate impact actually becomes more pronounced. And so the reality is Bloomington, like many communities, has two demographic trends that are occurring. We have a growing older adult population, and we also have a growing population of a more diverse BIPOC community. That community tends to be more likely into multi-unit housing, more likely to be working those essential jobs. Many of the staff members working at long-term care in some of our medical fields or at a grocery store, some of those essential workers are members of the BIPOC community. Then they're living in multi-unit housing and sometimes multi-generational. And so that's where we're really seeing some of the drivers behind that. And that gets back to some more structural issues of how our society was structured that way and where that is happening. So our work has been very focused in reaching the leaders in those communities to make sure we're having that relationship, because there's a lot of distrust and challenge that are long-standing historical issues. As we've developed some of our medical technology, we did a bunch of stuff that we shouldn't have done from an ethical standpoint, whether it was testing vaccines and processes on different population groups, or how we applied it or didn't apply it. So there's a lot of historical issues that give many communities, especially in the BIPOC community, a reason to not trust some of this process. And the way you get over that is really intentional relationships. You can't just start that in the middle of a pandemic. And so we've been able to tap into the relationships that the city has with many of our community members that have been built over years, and working through those processes to help overcome some of that vaccine hesitancy. Because the reality is, we're seeing in the data that plays out nationally is when when our BIPOC community is engaged and very authentically, there's a very good response for vaccination, but we're still seeing a large chunk of our community that doesn't want to get vaccinated, and that's often not always in the BIPOC community.
Sure. Yeah, no, there's a lot of history around just vaccines and vaccinations, and that's important to think about, and how you're dealing with that from a public health piece, and how we can all play a role in helping support the work that you're doing. One of the questions was about the recently passed and about to be signed into law stimulus funds, and I know a lot of attention has been given to individual support. But what about from local governments? From your perspective, are you expecting to receive funding that will provide, resources to do more work or different, or how are you expecting any sort of funds to come from the stimulus?
Yeah, we're anticipating getting a good chunk of the funding coming down that way. We anticipate a large amount coming to the state of Minnesota, very similar to the way we get a lot of our federal funding right now. Many would be surprised to know that the majority of public health preparedness funding is federally funded, and so most public health agencies in Minnesota, all of the work that did to prepare communities for things like a pandemic is federally funded. So we have a staff member in our public health agency that's entirely federally funded for that preparedness work. That money is crucial. Most of our budget is grants and contracts at the federal level. And so we anticipate getting a large amount of money to help continue our work with vaccinations. It's excited to think about how many people are getting vaccinated now, but I remind our staff all the time that we've done some of the easy work. It's gonna, to get to that high level of vaccine coverage, it's going to take a lot more work, more boots on the ground, more in the community work. And as we pivot towards the summer, we're going to see more and more of those pop up, very intentional in the community work, which are much more resource intensive. So the funding is going to come at a great time to help us continue to do that work and build the capacity for immunizing children, and potentially this becoming a routine vaccination like seasonal flu, where we're going to be doing this on a yearly basis.
Sure. Well, and that kind of leads me to, I don't necessarily want you to be the future predictor, if that's even possible, but you talked a little bit about, thoughts about how, this will go on, and, there's an immediate sort of thing, but then there's the longer term ramifications. I guess my question is about thinking, we talked before the call about trying not to use buzzwords, pivoting, unprecedented, new normal, and all that kind of stuff, but it's kind of hard not to, or all that. We know that we talk a lot in the business community about workspace and changes to the way we think about how we do work, these kind of calls and working remotely, that sort of thing. If you do kind of put on your, futuristic sort of lens, what are some of the changes that you think will be kind of longer term? And do we need to think, was this pandemic that kind of 100-year event, or are we likely to have, this happen again? The level of preparedness that we need to have on a regular basis, does that change or not? I mean, I know that a highly transmissible respiratory virus like we have now is something that we haven't had, but there have been pandemics in the last 100 years. So what's your thought on that from a public health viewpoint?
Yeah, so I think we go back to some of the old adages of, an ounce of prevention is worth a pound of cure. Like there's so much that can be done to prevent things like this from occurring, and we have a lot of insight into what that looks like and the cost for it. It's a fraction of the cost and economic and human impact to prepare and prevent things like this from occurring than it is to respond to it on the back end. There's pretty robust strategies that are available when we think about it from a global standpoint, because we have to look at this as a global issue. There's very little that we can do that only impacts the United States or Minnesota. And the reality for this is the end is going to be a more complicated time frame, because COVID is going to continue to change. SARS-CoV-2 will continue to mutate. We'll continue to see variants. And right now, the estimates are it's going to take until sometime in 2022 before most of the world is vaccinated. That means until that point happens, we're going to still see variants, challenges, transmission occurring in pockets all over the world that can always change things. The other reality is, I think, sometimes we relearn history that we forgot. And so when you look back, some of the impacts that happened in 1918 with the Spanish influenza, what occurred here in the US just was devastating worldwide. We saw a resurgence in how people designed buildings and lived in places. So many people can relate to having that radiator in your apartment or some place that you lived or worked that just was always so hot and it was impossible to deal with it. Well, the reality was those things were designed to increase the ventilation where you were, so you could keep your windows open in the winter, and the radiator compensated for the cold weather coming in. We knew way back then how important ventilation was. And the ventilation, I think, is going to become one of those key things. we're seeing almost no influenza, no respiratory transmission of other pathogens this year, largely because we're at home, we're masking, or we're doing all these other mitigation strategies. So we're going to have to ask ourselves as a society, what are we willing to deal with on a routine basis? As a parent of 3 kids, I've watched my kids have almost no infections this year. Normally, we're dealing with the constant runny nose for months during the winter, and we didn't see that because of these things. So there's those trade-offs of how do we bring people back into the workplace, remain socially distant, change some of the ways we do ventilation and interact to mitigate some of these issues. I don't exactly know where we're going to go on that. It's a big question society is going to wrestle with in how we do it. There's pros and cons to both of those things. I miss being with my colleagues in rooms and having meetings and doing some of those planning and strategic aspects, but I also don't miss getting sick all the time from my kids getting respiratory infections and then bringing it into the workplace. So there's those things that we're going to have to figure out our path forward in the context of a pandemic with vaccines rolling out and a whole lot of changes to those guidances as we adapt to what this new normal is.
Yeah. Well, and the final question is really about understanding the tracking of the population having received vaccines, and there's the privacy concern. I know how many vaccines have been delivered. You talked a little bit earlier about the uncertainty of the critical mass of what percentage of the population needs to be vaccinated to get to this, that, or the other level. And I guess along those lines, what roles can businesses play? Can they incentivize workers to be vaccinated, communicate more effectively around that? And also, you mentioned a little bit too, kids. I mean, I think kids have been, there's a lot of uncertainty or different sorts of communication around how likely they are to be infected, to be carriers, that sort of thing. And, should they be vaccinated? And so I guess that big piece of, how we know we've succeeded on the vaccination level is what I'm asking.
Yeah, so I think we're going to have a few different metrics on that end to say we've been successful. In the state of Minnesota, we have a great information system to track that information. So we get really good data. Every one of our clinics, it's almost in real time. It goes back to the state and we're sharing that data. So we're going to have pretty good insight here in Minnesota. How that translates into conversations more or nationally or globally about travel and other things with immunity passports is a thorny challenge and ethical, because there's a whole lot of infrastructure and the ability to do that. On the business end, anything that you can do to reduce the barriers for your staff getting vaccinated. I can tell you, working clinics, we've had some employers that have just been phenomenal, very flexible with time, capacity. If you got access to an appointment in the middle of the workday, go do it, and finding ways to cover that. And other employers that have been, it's been much more of a challenge where people have ended up needing to take like the full day off work and do some other things just to get a vaccine so they can keep working. So the more you can reduce barriers and help your staff get access to that with communications, encouraging them to sign up for the vaccine connector, working with your occupational health, connecting with local public health on, hey, we're prioritized now based on the governor's guidance, help us get vaccinated. The better off your staff are going to be and your workforce. On the kids end, I think we're going to see vaccines authorized for kids at some point this summer or early fall. And then it's going to be a process to get our kids vaccinated. And then as we continue to see the impact of variants and coverage, we're likely going to see this become more of a routine vaccination, whether it's a yearly, every 3 years, 2 years, we don't know. We're only a year into this pandemic, so we don't have the answers to some of that longer term stuff. But I think front and center is going to be making sure that the rest of the world gets vaccinated too, because we continue to see the impact to travel, and I know everybody wants to travel and go back to doing some of those fun things. But if you're traveling and going to places that aren't vaccinated and they're not safe and you're bringing things back, that poses other challenges too.
Yeah. Oh, just the terminology. We're only a year in. It's spoken like a true public health expert. But I can't thank you enough, Dr. Kelly, for not only taking the time this morning, but just the work that you and your team does. It's so meaningful to the citizens in our community and larger stakeholders, and we're in a much better place for all of your efforts. So thank you very much for that. Thank you to everybody who was able to join us today. This program has been recorded and we'll be able to share it. If you know people who might benefit from checking it out, we'll be able to do that. Again, I'd like to thank the sponsors for Bloomington Chamber Town Talk, the Mall of America, My Credit Union, CenterPoint Energy, Excel Energy, and Wells Fargo Bank. And finally, I just want to talk about some other chamber programming that's in the near future. If you're able to join, we'll have another town talk in May. But tomorrow we'll hear from Minnesota Deed Commissioner Grove about workforce. Next Tuesday, we have a public policy South Metro series focused on Bloomington affordable housing. And then on the 24th, the Bloomington State of the City, which we were not able to hold last year. So more is built up. I hope you're able to attend those. In the meantime, everybody have a great rest of your day and week, and we'll talk to you again soon. Take care.